How does hilar lymphadenopathy show up on a TB X-ray? Imagine looking at a chest X-ray and noticing unusual shapes or shadows near the center of the chest. That's often where the hilar region is, where major blood vessels and airways enter the lungs. When someone has tuberculosis, especially in the early stages or in children, the lymph nodes in this area can become swollen. This swelling is called hilar lymphadenopathy. On a chest X-ray, hilar lymphadenopathy appears as a rounded or lobulated mass at the hilum, which may look like a dense, abnormal shape. It can cause the normal contours of the hilum to become widened or distorted. Usually, this enlargement is seen on one side, making it unilateral, but sometimes both sides can be affected. The enlarged lymph nodes can partially or completely obscure the usual structures seen in the hilum, such as blood vessels and airways. In children and infants with primary tuberculosis, the lymph nodes are often quite prominent. They may appear as a bulging or lobulated mass, sometimes causing airway compression. This can lead to signs like narrowing of the bronchi or air trapping, which might be indirectly visible on the X-ray as areas of hyperinflation or abnormal lung expansion. While a chest X-ray can give important clues, it might not always clearly show lymphadenopathy, especially if the swelling is mild or early. That's where computed tomography scans come into play. CORT scans provide a much clearer picture, showing enlarged lymph nodes with possible central areas of low density, indicating necrosis or caseation. They can also reveal calcifications or the effect of lymph node swelling on nearby structures, making them the gold standard for confirming hilar lymphadenopathy in tuberculosis. Key features to look for on a chest X-ray include increased size and abnormal shape of the hilar shadows, often appearing as rounded or lobulated densities. These may obscure normal vascular markings and are usually more prominent on one side. Sometimes, the lymph node enlargement is accompanied by lung changes like consolidation or opacities near the hilum. Signs of airway compression, such as narrowed bronchi, can also suggest lymphadenopathy. In summary, hilar lymphadenopathy in tuberculosis shows up on X-rays as unilateral or bilateral, enlarged, rounded, or lobulated shadows at the hilum, often with abnormal contours and densities. While chest X-rays are useful initial tools, CORT scans provide a more detailed view, helping doctors confirm the presence and extent of lymph node swelling. Always remember, if you or someone else has symptoms or concerns, consulting a healthcare professional is essential for proper diagnosis and treatment.